Ending this project not only silences promising solutions for a neglected group of patients, but also sends a devastating message to future researchers that even life-changing, evidence-based science can be discarded without cause.
That's a doctor doing research at Duke in a viral video viewed more than 1 million times on social media. Sickle cell anemia is a blood disorder affecting 100,000 people in this country. 90% of them are black. Her grant was recently terminated by NIH, and now she's taking her fight public.
WRAL health reporter Grace Haba spoke to the doctor and the Trump administration about what exactly led to the money being taken away and what's next.
What would you do if you knew a disease that's taken the lives of your own family members is still causing thousands of other people to live in debilitating pain every day?
I really want to focus my attention on just to improve clinical care and to improve research for people with sickle cell.
If you're Dr. Charity Oyedeji, you face it head on.
When you started seeing these cuts come down and impacting the medical field, did you think you were going to be a part of it?
As a black investigator studying a population that's predominantly black, I'm at risk.
What was supposed to be a 5-year, $750,000 NIH grant supporting her research through Duke University was suddenly terminated June 16th.
The termination letter, the words that were used were very non-scientific, very racist.
This is the termination letter Oyedeji says she received from the NIH. In it, the NIH cites DEI, stating it is the policy of the NIH not to prioritize such research programs.
After speaking with Dr. Oyedeji, I sent an email to the White House and the NIH for comment, asking how it was decided that her grant would be one of the ones cut. I got a response from HHS Communications Director Andrew Nixon, who says the grant doesn't align with the current administration's goals. He stated the study itself has value. However, unfortunately, it was funded under an ideologically driven DEI program under the Biden administration. He then went on to say that in the future, these types of programs that the NIH will fund for sickle cell and other important diseases will be reviewed based on their scientific merit rather than on DEI criteria.
There is an appeal process, which Oyedeji says she will pursue, as she encouraged other researchers to stand up and speak out.
I would say keep fighting, don't stop, because that's what they want us to do. These are not handouts. These are things that people have worked years to get.
Grace Haba, WRAL News.
And the same day Dr. Oyedeji received her termination letter, a federal judge ruled some other recent NIH cuts by the Trump administration were illegal, calling them, quote, government racial discrimination.